This liquid, being oxygenated through agitation, contains microorganisms that are used to create vaccines. Dr. Peter Hotez, who directs vaccine development at the Baylor College of Medicine and Texas Children's Hospital in Houston, says vaccinating people near conflict zones could prevent an epidemic.
For once, could the world be proactive in thinking about these diseases rather than slowly reacting to a crisis?
He cites last year's Ebola outbreak in West Africa as an example of the world reacting to contain the disease only after it became a crisis. He says there had been some progress in developing vaccines for Ebola, but no clinical trials occurred until after thousands of people had died of the disease. Hotez is developing a plan to establish vaccine-producing laboratories, much like the one he operates in Houston, in Saudi Arabia, Qatar, and Morocco, all of which, he says, fit the right profile.
There's already a stable government, there's a certain level of sophistication in terms of ability to make biotechnology products, and there's the political will and economic horsepower to make it happen.
These countries could then identify potential outbreaks and get vaccines to refugees and others near the areas controlled by ISIS where health workers dare not go. Hotez says an epidemic could start with infected people coming out of an ISIS-controlled zone, infecting others.
The diseases that emerge out of those ISIS-occupied areas are also eventually going to affect and destabilize the entire Middle East and North African region.
With help from the U.S. State Department, Hotez has traveled to Morocco, and he says officials there recognize the health threats from disrupted nations to the east, as well as the recent Ebola epidemic area to the south. He says the Ebola outbreak showed the need for public financing of vaccine development and production.
The Ebola crisis really highlighted what happens when you have a disease for which the vaccine technology is available, but you have a market failure because there was no incentive for the big pharmaceutical companies to get involved. Excellent.
Hotez says he plans to visit both Saudi Arabia and Qatar in the coming months to discuss his epidemic prevention project with officials there. Flakus, VOA News, Houston.